Hi everyone, my name is Menisha Lakhram, and I'll be talking about my PowerPoint and my disability and my PowerPoint and what I research on. So my topic is learning disability and college life. So when I was a little kid, the doctor then cleaned my ears, which led to an ear infection, and I had surgery on one of my ears. If you ask me which ear, I don't know. So it slowed me down school. So when I was in elementary school, I had a lot of help. My mom would take me to after school lessons, wait there till I was done. When I was in high school, I did a program called Gear Up at NJCU, which also helped me as well in school, and it helped a lot because I was able to pass elementary and high school. Okay, so college experience. So when I was in college, I was totally lost because my parents didn't know, didn't go to college, and then I was on my own because I'm a first generation. My friends will I have the help that I had in high school and elementary? Yes, I had the help because my professors helped me. They would understand. I would go tutoring, use the writing center, and I would do the same semester, same thing for every semester until I finish. Yes, I passed. What's this? I barely put most of the GPA that I was hoping for, but I passed and I was able to graduate. My advice is for students who have learning difficulties is take advantage of the tutoring and the extra time that schools have to offer. Without the help that I receive, I wouldn't be able to be where I am today. I'm in graduate school and working a full-time job. And my full-time job is the A. Henry Moore School. So I'm an NJCU employee, but I work at A. Henry Moore School now, so I'm a teacher. So I'll be talking the history of the disability. A person could be born with learning disability if he or she does not get enough oxygen during childhood, has trauma to the head, or is born to learning after birth. Is learning disability caused by early childhood illness, be accidents, and seizures. I didn't really have any of that. Only I had was I was born 2 weeks before my due date. And I was blue by the time I was sad blue when they put me on my mom's stomach. Yeah, that was supposed to be born on March 31st, April 1st. Now I'm born April 2nd. Back then, I'm from Guyana, so April Fools. April 1st is All Food Day, so back in my country, people will mock all the people who was born on April 1st. And my dad wouldn't want that, so that's when he kept me past 12 after. Keep her in till past 12 o'clock. Once April 1st is gone, then she could be born. No one knows really what causes a learning disability. Often learning problems can run in family shenanigans, but if I but excuse me, but environmental factors could play a role too. Most learning disabilities occurs because there is an enormous range of variation that occurs normally in people's cognitive strength and weakness. For many children, the causes of their intellectual disability is not known. Some of the most common factors causes of intellectual disability like Down syndrome, fetal alcoholism, fragile X syndrome, genetic condition, birth defects, and infections happen before birth. So the second one that I'm about to show you, this was back during the day, like mom's circling. So things have Things change since back to now. Children that are born with disabilities, people back in it, people won't want them. People will just left them in the woods to die or left them on their own. And this was back in the day. And I think that was wrong. My advice for future students is take advantage of the help that you get, because without the help the schools offers, it will become hard, and the future students will struggle. For example, without the help that I gotten, I would struggle in school, and school would be hard for me, and I wouldn't be enjoying great school. My next advice is for future students who have this is to take your time. On assignment, there's no reason to rush. And the teachers and professors will understand. You could say, "Hey, professor," or "Hey," you can use my name because I'm a teacher. "Hey, Miss Menisha, I need help on this. I need extra time on this." And the teachers and students will take their time. Like, for example, my student needed more clarification, and he called me, and I sat right next to him and took his time. I was patient with him, and he able to guide me. When working with students who have disabilities, you have to be extremely patient with them. If they need help, sit next to them until they finish it, until they get it right. Communicate with the teachers and professors. They could be big help as well. So the treatment is extra help. A reading specialist, math tutor, or trained professional can teach your child ways to do schoolwork, study, to get online. So every student who has disability has the IEP or 504 plan. The IEP is individual education plan. This written plan sets learning goals and describes the special education service your child needs. Public schools develop IEPs for students who challenges meet the school system guidelines for learning disorder. In some countries, IEPs are called individual education plan. Changes in classroom. These are also known as accommodations. For instance, for students with learning disorders get more time to complete work or tests, they may be asked to do fewer math problems as assignment, and they may get sitting near their teachers to boost attention. Some math problems are allowed to gadget. These could include calculators to help solve math problems and program that text into speech. You can hear. The school also might be willing to provide audiobooks to listen while reading along with physical therapy. So my accommodations are I need extra time on tests when I do tests, and when there's math problem, I need a calculator. I think so. The last set of treatment is therapy. Different types of therapy may help. Occupational therapy might improve writing problems. A speech language therapy could help with language. My job has occupational therapy and speech therapy as well. So I'm gonna ask if it does have if the occupational therapy help improve the writing, or if speech language therapy help with the language. Well, I know that from when I'm picking up a student's speech, they read with them and make sure they understand how to read and understand the words and how to speak, so help with their language skills as well. Medicine. Your child health care provider might need suggest medicine to treat depression or anxiety. Medicine for ADHD may help a child's ability to focus at school. Comprehensive excuse me, an alternate treatment. More research is needed to find out if these treatments work for lung disorder. They include diagnosis, vitamins, eye exercise, and the treatment backwards for brainwaves called neurofeedback. So that's the end of my PowerPoint. I hope you guys liked it. If you have any questions, I'll be willing to answer it. Thank you for listening, looking at my PowerPoint. Thank you. Bye.